Contaminated water and poor sanitation are linked to diseases such as diarrhea, cholera, typhoid, dysentery. Many people lose their lives to these diseases. However, with adequate care and precautions, people can stay safe from such conditions. On this episode of Health Watch, we highlight some of the common waterborne diseases and how to prevent them. According to the World Health Organization, WHO, over 2 billion people live in water-stressed countries, which is expected to be exacerbated in some regions as a result of climate change and population growth. Globally, at least 2 billion people use a drinking water source contaminated with feces. Microbial contamination of drinking water as a result of contamination with feces poses the greatest risk to drinking water safety.
The numbers of diarrheal cases are increasing. But when you go further to, which is not very important for this, but when you go further to the laboratory, you will be told exactly what kind of ailment somebody is suffering from. Like if we take a case of where our Minister for Health went, you realize that it was said that they have taken samples for further analysis. But I also want to, I saw another Kenyan, either out of the frustration, castigating the county of Kakamega. You know, there are levels of laboratories which actually do other tests which are a bit complicated. Frankly speaking, Kakamega will be having a laboratory, but there are also samples which are referred to highly technical labs, like in a place here we have got a chemistry. So that is a perfect action. What needs to be awaited is to what are the results and what needs to be fixed. We might have quite a number of health problems arising from the rains. More so right now in our country here for quite some time we have not been having rain, meaning the water containers must have dried, and for a long time if people or the users didn't bother to wash the containers, plus including the gutters if they are using gutters, plus even if there are areas people were getting water. I am aware that some water sources dried, meaning even the piping, there must have been no water in the piping. Safe, I hope that in situations like that, there is also there is no leeway of having some wastewater mixing or passing through the pipes. That can be a risk. That is in terms of microorganisms, like on the roof surface or the gutter. However small the amount, if the area the water which is coming in washes either the dropping or whatever to the container, and if it is left for quite some time, the amount of the microorganisms would multiply. That would be a huge amount of microorganisms that can actually cause a serious problem in any given place. Number two, when we have more water than we require, we are bound to have the wash. You know, the water will now not go to some places or some river. Some will be passing through the roads, the open land. And in some cases, it goes through the waste treatment plants. It goes through the toilets, the pit latrines, and that is washed. And if it is washed and it goes to the river, in most cases maybe, and people now are anxious to get more water, you might be taking water. If you don't also bother to treat the water, you are likely to be collecting some microorganisms.
Experts say that safe and readily available water is important for public health, whether it is used for drinking, domestic use, food production, or recreational purposes. Improved water supply and sanitation and better management of water resources can boost countries' economic growth and can contribute greatly to poverty reduction.
Fortunately, I was still working for our country, and I think I participated in those two statements of water and health being a right. But you know that actually it says it is a right to be given that, which is actually also is commensurate with what the country can be able to give. But I think working together with the people, the community, the people, the population, the government, the civil society, and others, we should be able to actually narrow access to save water so that we have big numbers. I know globally also, because I used to represent East and South Africa in sanitation and water for all. The rallying call is that not leaving anybody behind. That is the rallying call. So it is incumbent that everybody should be able to have access to clean water. And essentially, if that happens, do you know that we would have reduced remarkably the number of simple, you can call them actually simple, which will require simple measures, so that we reduce the numbers in terms of the people who are actually getting sick. We will be reducing the amount of money we are using in terms of the treatment. It doesn't matter. One will see like we are using, one might actually even trivialize that maybe a dose of one individual. Let us even say 10 shillings. If we had 5 million times 10, that's huge money. If we can save that one, that money is good for us. So I think, and I believe the country should be able to strive and strengthen issues preventive if we have got to sustain the health service delivery to all of us.
Inadequate management of urban, industrial and agricultural wastewater means that drinking water of hundreds of millions of people is dangerously contaminated or chemically polluted. Natural presence of chemicals, particularly in groundwater, can also be of health significance.
The biggest problem is what we discharge into the rivers from effluent, solid waste, liquid wastes, chemicals that are discharged into the river are the ones causing this pollution. Discharge into the river, into the lake, into the ocean is a very, very serious offense. So let me not even explain to you the consequences that comes through. Here you are discharging raw seawater into the river, into the water. Nobody, no fish, nothing will survive downstream.
Article 22 of the Constitution provides that anyone can move to court if there is threatened contravention of the Constitution, or if he thinks the government has done any action or has omitted to take any action to protect them. Ideally, there is a principle that someone can be ordered to restore the environment. If you have polluted, you are told that this is what you have done, so take an action that is going to restore, plant trees, treat your sewer and all that.
These toxins are consumed by humans and therefore end up causing serious problems like cancer. We have miscarriages coming from these problems, and we have things like impotence in men coming from lead pollution.
WHO estimates that some 800,000 people die each year from diarrhea as a result of unsafe drinking water, sanitation and hand hygiene. Yet diarrhea is largely preventable, and the deaths of 200,000 children could be avoided each year if these risk factors were addressed. Where water is not readily available, people may decide hand washing is not a priority, thereby adding to the likelihood of diarrhea and other diseases. In 2010, the UN General Assembly explicitly recognized the human right to water and sanitation. Everyone has a right to sufficient, continuous, safe, acceptable, physical, accessible, and affordable water for personal and domestic use.
Water, they have their need of water because it is scarcity, it is scarce, and also it is a basic need. So now, that is one of the problems these people have.
We need to collectively come together. We need to ensure that disaster management works holistically, it's integrated. We work in a nexus approach where development, peace, and all these kinds of things are working together so that we are able to do these trigger models and thresholds at each of the counties where they can be able to analyze and collect more data. So the early warning system must be boosted. We would like to see the community health system, which the government is working and using with the health information system, to really pick up all that data at the very lowest level, and it's used for analysis. Right now there's a disconnect. We're only relying on the early warnings that are provided by NDMA and the KMD. But already these indicators have been tracked by the health information system.
Can we have our laws work? Can we have certain punitive, reasonably punitive measures to disallow discharge, to allow riparians move out, to allow some sort of cleaning up on what we have? Finally, the most important is ensure that the sources of these streams, rivers, are indeed protected, particularly the wetland areas.
Sustainable Development Goal Target 6.1 calls for universal and equitable access to safe and affordable drinking water. The target is tracked with the indicator of safely managed drinking water services, drinking water from an improved water source that is located on premises, available when needed, and free from fecal and priority chemical contamination. Safe and sufficient water facilities, the practice of hygiene, which is a key measure to prevent not only diarrheal diseases, but acute respiratory infections and numerous neglected tropical diseases. Purity Musenzuki, KT News.